As per Globocan data 2020, oral cancer ranks second in India after breast cancer. Oral cancer in males ranks first up, and in women it comes to an incidence of around 5%. Worldwide, oral cancer ranks 17th position, and if you compare the incidence of oral cancer worldwide and in India, you can notice that oral cancer ranks second in India, whereas it ranks 17th worldwide. So you can understand the amount of healthcare burden that oral cancer creates on the Indian healthcare system. The World Health Organization has always stressed the importance of prevention and early detection of oral cancer. When you compare other cancers, oral cancers occurs at a site which is very easily clinically accessible and which usually starts in the form of a pre-malignant lesion, which can be easily detectable. This can be treated as an advantage, and the healthcare workers can identify such lesions in the population and thus prevent oral cancer at an early stage. With the poor dentist population ratio, particularly in the rural areas, adjuvant aids can be used to detect such premalignant lesions using the help of primary healthcare workers. Research has shown that using primary healthcare workers along with adjuvant aids to detect oral cancer has shown better outcomes.
Simple visual examination is often limited by subjective interpretation. Occurrence of oral squamous cell carcinoma, early changes especially, is often seen in the oral cavity, which is missed by the naked eye. As a consequence, early detection of oral cancer is always missed. Adjuvant techniques are therefore used to differentiate between benign abnormalities and malignant lesions. These techniques not only help in the identification of benign from malignant, but also help in delineating areas of dysplasia within a normal looking lesion. These adjuvant techniques include toluidine blue, brush biopsy, chemiluminescence and tissue autofluorescence. After indigent training, the paramedical staff located in a primary healthcare center or a health camp will capture images of suspicious looking lesions using the Dr. Oroscope device. After capturing these images, the software will then analyze and give point of care diagnosis. These images can then be transferred to a tertiary healthcare center so that the specialist can further evaluate and manage these suspicious lesions. Along with detection of these lesions, the device also helps in delineating areas of dysplasia so that it also aids in analyzing the area of the most appropriate area for taking biopsy from the lesion. Since the screening can be performed at a public healthcare center or even a health camp, it becomes really easy to screen these oral lesions in mass. So mass screening and screening a large number of population becomes very accessible and easy using Dr. Oroscope device. This will help in the development of a nationwide cancer database or a registry, which will further help in early detection and hence early management of these precancerous and cancerous lesions. This early detection and management of oral cancer will further help in reducing the global burden of oral cancer.
Dr. Oroscope, an indigenously developed non-invasive oral cancer screening device, which is very much cost effective, and it has been registered with DCGI as a Class A device. The existing devices which are all available presently in the market, they are very much useful or more effective in the dark atmosphere, but the intraoral nature of this Dr. Oroscope, where we have the high definition camera incorporated in the device, we can insert into the oral cavity without touching any parts of the oral cavity, and we can capture the images under the influence of various lights, that is blue and green amber. These lights will give us different images which can be compared by a software which is supported by Dr. Oroscope device, and this software also contains some part of brief case history of the patient. which is also helpful in the diagnosis and which is very much important in the diagnosis of pre-malignant and malignant conditions. So these kind of lesions can be diagnosed based on the habits and the histological evaluation of the lesion. So considering all these aspects of the lesions, the AI based software is incorporated into the device, so that the accuracy and the sensitivity of the device is 100%, because the cost effective oral cancer screening device should have the maximum sensitivity to screen the mass population. Or the case sheet will be uploaded to the tertiary healthcare center, where the specialist can analyze these lesions and they can give the support by telemedicine facility.
Dr. Oroscope is an indigenous, cost-effective solution for oral cancer screening and is based on the principle of autofluorescence. It is a non-invasive, handheld, portable intraoral device that emits light of specific wavelengths in the blue and green amber sector to facilitate easier detection of abnormal areas of the oral mucosa. It is equipped with a high-definition camera that facilitates capturing images from suspicious lesions and using them for comparison during follow-ups. The device has been registered as a Class A device with Drug Control General of India. The device is supported by Dr. Oroscope software application, which can be installed in Android phone or tablet or computer. A brief history of the patient can also be recorded on the application. Software helps in image processing to enhance the clarity of the lesion through appropriate filters. The processed images can be stored in a database and retrieved at any point of time for cross-reference or comparison during follow-up. Green amber light is absorbed by hemoglobin, which is predominant in inflammatory lesions, but not by other fluorophores, which are associated with dysplasia. Thus, we can differentiate between inflammatory and dysplastic lesions using images captured under green amber and blue light. The software also considers the patient's history to give an AI-based diagnosis. For example, a keratotic white lesion will be diagnosed as leukoplakia only if it is associated with tobacco-related habits. While leukoplakia is considered as a potentially malignant disorder, other white keratotic lesions can be benign.